Hello, I'm Dr. Abdul-Aziz. Welcome to today's lecture. We will continue to our hospital policies and procedures for credentialing and privileging. Scenario number 1. A physician applies for a special clinical privilege. What must the physician provide to support their application? A. A letter of recommendation from a colleague. B. Proof of appropriate credentials and clinical competence. C. A detailed personal statement. D. Payment for the application process. Correct answer B. A physician is responsible for providing evidence or proof of ownership of appropriate credentials and qualifications, as well as clinical competence, to justify their request for clinical privileges. This emphasizes the need for tangible, verifiable proof of the physician's ability and qualifications specific to the requested privileges. 2. If a physician does not have documented evidence of performance for requested privileges, what process may the department head initiate? A. Immediate approval of the request. B. A supervision process to assess competence. C. A formal warning to the physician. D. Rejection of the application. Correct answer B. If an applicant lacks documented evidence of the necessary performance for the requested privileges, the department head may initiate a supervision process. This process is designed to assess the physician's competence specifically related to the privilege and involves objective criteria such as direct observation and monitoring of methods. 3. Who decides on requests for privilege approval? A. The health institution director. B. The medical services director. C. The appropriate department head. D. The Credentials and Privilege Committee. Correct answer C. All requests for privilege approval are decided by the appropriate department head. This decision-making process involves coordination with the medical director, who then submits the application to the Credentials and Privilege Committee for further consideration. 4. In the case of a denial of privileges by the Credentials Committee, what is the applicant entitled to? A. Immediate approval of alternative privileges. B. A review of their application by an external committee. C. Compensation for any inconvenience caused. D. A fair hearing and appeal process. Correct answer D. If the Credentials Committee decides to deny, review, reject, or cancel any privileges, the applicant or medical staff member has the right to a fair hearing and appeal process. This process is in accordance with the medical staff's regulatory guidelines, ensuring that the applicant has an opportunity to contest the decision. 5. How is the final action of the Credentials and Privilege Committee communicated to the applicant? A. Through a written offer from the health institution director or delegate. B. Via a public announcement in the health institution. C. Directly by the Credentials and Privilege Committee. D. Through an email from the department head. Correct answer A. The final action regarding the applicant by the Credentials and Privilege Committee is communicated to the applicant through a written offer provided by the health institution director or their delegate. This offer includes details about the granted privileges and any adverse action related to the application, ensuring clear and formal communication. 6. Who is ultimately responsible for notifying the department head of the final decision on an application for privileges? A. The Credentials and Privilege Committee. B. The Health Institution Director. C. The Medical Director. D. The practitioner applying for privileges. Correct answer B. The Health Institution Director is responsible for notifying the department head of the final decision on an application for privileges. This is done through the medical director, ensuring a structured and hierarchical communication process within the institution. 7. What information is included in the written list given to the practitioner regarding their privileges? A. A detailed job description and salary information. B. A history of the practitioner's application process. C. A list of all department members and their privileges. D. A list of initially granted, renewed, revised, or rejected privileges and a notice about the scope of patient services. Correct answer D. The practitioner is provided with a written list that includes initially granted, renewed, revised, or rejected privileges. This list also contains a notice indicating that the scope and content of the practitioner's patient services are limited to the privileges listed. This ensures clarity and sets boundaries for the practitioner's scope of work in the health institution. 8. Who is primarily responsible for the accreditation and privilege documentation program at the health institution? A. The medical director. B. The health institution director. C. The department head. D. The human resources director. Correct answer B. The health institution director is the primary individual responsible for the accreditation and privilege documentation program. This role includes being the designated authority for employing physicians and dentists, ensuring compliance with regulations, and making final decisions. 9. What is the role of the medical director in the process of reviewing credentials and professional competence? A. They solely make the final decision on applications. B. They provide training to applicants. C. They share the responsibility with the medical staff for reviewing credentials and competence. D. They directly grant or reject privileges. Correct answer C. The medical director shares responsibility with the medical staff in reviewing credentials and professional competence of applicants for appointment and reappointment. This role includes ensuring that all practitioners receive a copy of health regulations and policies and obtain a declaration of adherence to them. 10. What are the responsibilities of the Credentials and Privilege Committee? A. Providing training and supervision to new medical staff. B. Directly employing physicians and dentists. C. Processing all accreditation applications. D. Reviewing and evaluating credentials and making recommendations for medical staff membership. Correct answer D. The Credentials and Privilege Committee is responsible for reviewing and evaluating the credentials of the accredited medical staff. Their responsibilities include making recommendations to the health institution director regarding approval or rejection of the applicant's request for medical staff membership and granting, reviewing, modifying, or withdrawing privileges based on various criteria such as credential data, employee performance, and competency assessment. They are also responsible for granting temporary, emergency, and disaster privileges as stipulated in the policy. Thank you for joining us. Stay tuned for more policy reviews.